My name is Tracy Plouck, and I'm the director of the Ohio Department of Mental Health and Addiction Services. I wanted to spend some time today and provide some highlights related to the governor's budget and the state's operating budget, really, for the fiscal years 14 and 15. This budget becomes effective July 1st, 2013, and it's relevant to all Ohioans. As we're all aware, the governor's #1 priority through this administration is the creation and the sustainability of jobs. If we don't have jobs in the state, we will not have people who want to live here and be productive residents. And so jobs are absolutely critical. To that end, this budget contains tax reductions of a net $2.7 billion. This is going to help make Ohio more competitive with other states and really with the world in terms of job development and job retention. Absolutely critical. Another critical component to job creation is education. And this budget contains an education plan that makes an additional $1.5 billion investment in schools. And that is a critical piece as well. There's also a new funding approach, funding plan for Ohio's public colleges and universities. And if individuals are not matriculating, that is clearly a problem because then they will have loans that they can't repay if they don't finish college. And so making sure that graduation occurs and that will help sustain or augment the workforce for these jobs that are being created. It all fits together. But college and university funding is another significant component of the governor's budget. And then finally, there's an additional $3 billion in incentives for innovations for state and local governments to meet some infrastructure needs. And clearly, with a limited amount of resources, we need to be creative in the way that we're working together. And this has been a key priority, a key theme in my 2.5 years in the my previous role that I had with the Department of Mental Health. And I'm glad to see that this is extending, continues to extend to all of state government. So really helping provide incentives for communities to think differently about infrastructure. I want to talk now about Medicaid. Department of Mental Health and Addiction Services is a member of the Office of Health Transformation, which focuses on health and human services policy and in large part Medicaid policy for the state of Ohio. The governor's budget contains program integrity initiatives that will help cost avoid approximately $74 million related to the Medicaid program. We see this as a way to continue to refine areas where we can be more efficient in the use of dollars, and so we see this as certainly progress forward. Another way that we're demonstrating progress forward in the overall Medicaid arena is the procurement of a new eligibility system for Medicaid and ultimately for other health and human services programs throughout the state. And that work continues, and the first phase of this new eligibility system will go online in October of this year. So it will be incremental over the next couple of years, but you'd be looking forward to hearing more about that from the administration very soon. We are also updating provider regulations to be more person-centric, and see that certainly as a positive step forward as we try to focus more on outcomes for individuals. Making sure that the provider regulations are consistent with that philosophy is very important as well. And then also the state has plans to move forward with the Balancing Incentive Program. And this is a multi-agency partnership with communities across Ohio to put ultimately more emphasis, as we've continued to do for a number of years, but more emphasis on community-based care relative to services rendered in institutional settings. And so we have some enhanced federal dollars as a result of our participation in this federal program, and you can look forward to more information on the BIP program, or Balancing Incentive Payments, soon as well. One item that is not present in the governor's budget that was enacted by the General Assembly is Medicaid expansion for childless adults up to 138% of the federal poverty level. This is not a dead issue. I want to be very clear that the governor continues to wholeheartedly support the extension of health care for Ohioans who today, in many cases, are working, but certainly are struggling to find access to basic primary care and other needed services in order to help them be as stable as possible for their families and as productive as possible as a member of the workforce here in Ohio. And so we're going to continue to work with the General Assembly over the next weeks and months in order to hopefully ensure that Medicaid can be extended to our neighbors and throughout Ohio who absolutely would benefit from access to health care. So be looking forward to more information on that certainly as we continue. Want to drill down now just a little bit to some of our department-specific initiatives. One area that we're really excited about is a new series of strategies called Recovery Requires a Community. And this actually helps to support progress that we've made in the last 2 years to help individuals who are under 60, mentally ill, and living in nursing facilities transition back at their request to community-based settings. Without really causing much attention to this population, we've been able to support the transition of almost 1,000 folks in the last 2 years back into community settings. What we want to do is build on this progress in the next 2 years, and through a partnership with Ohio Medicaid, we are planning to assist at least 500 folks in the first year of the biennium in fiscal 14, and then 700 folks in fiscal 15 to transition from nursing homes back into the community. Sometimes there are obstacles, like housing as an example, or maybe there's very limited transportation or limited access to social engagement, depending on where you're going in Ohio. And the ability to have access to those kinds of supports is really critical in order to be able to sustain in a community-based setting. And so we're going to be working with Ohio Medicaid and all of our community partners to overcome those obstacles. And we've got a moderate infusion of resources that will allow us to do so. So we're already working, and we're very excited about this. Another new feature of our budget this year is called Community Innovations. And this is a new general revenue fund line item that has $1.5 million appropriated in each fiscal year. And the purpose of these dollars is to make a moderate infusion of resources somewhere that will improve outcomes for people, and number two, reduce costs in some other area of government, whether it's local government or some other area of state government. We identified the $1.5 million to place into this line item by planning to spend less on administration this year as a newly consolidated agency. And so we feel that this is absolutely an opportunity for us to walk the talk and try to be more judicious on the admin side so that we can invest more resources for clients who are struggling with gaps in their continuum of services. This biennium, though, we want to make the investments for community innovations in targeted demonstrations with county jails. We've been working on a discussion work plan with the Ohio Buckeye State Sheriff's Association for over a year now, and we're at the point where we want to use these resources to execute some demonstrations that we believe will demonstrate progress and then will help build the base for further progress down the road. This will include things like the use of telemedicine to connect inmates with case management services, maybe from a couple of counties away, or use some resources in the jail setting to help prepare people to leave the jail and connect with housing or connect with the kinds of recovery supports, whether they be for addiction or mental health, that will really help them avoid recidivating and returning to jail in just a couple of days because they don't have connections to the resources that assist them in their wellness. So that's going to be kicked off here very soon, and we are excited about that. As I mentioned a couple of times now, we are a newly consolidated department effective July 1, and we see this as an opportunity to make it easier to do business with us as a department within the state of Ohio. I want to be tested in a year. Anywhere, I can go out in Ohio and ask a provider, is it easier for you to work with us? I would like to have some examples of why this is indeed the case. Also, talking with clients around the state, is it easier to have access to services? Now, clearly something like the Medicaid expansion would be hugely beneficial in this regard, and we continue to work toward that. But I think even examples of our ability to redirect resources into some partnerships with The county sheriffs would be another example of how we're trying to further extend services to folks who need them. So these are just a couple of highlights related to what we're doing in this budget. We have many, many other things, but I just wanted to take an opportunity today to feature some items with you. Overall, our department spending, our appropriation levels for the next 2 years are, you should see them listed on the screen here. Our funding for this fiscal year is about $369 million in general revenue funds. And in the aggregate, including all fund sources, it's almost $700 million. And then there's just a small variation in fiscal 15. But in general, I think that we're treated very well in this budget. And the small decrease that you would see between 14 and 15 is related to the run out of Medicaid claims. I'm sorry, from 13 to 14 is related to the run out of Medicaid claims from our system, because those are now covered through the Ohio Medicaid department. Also, we have a legislative infusion of $50 million per year in this budget. $30 million is designated for mental health, and approximately $20 million is designated for addiction services. And so we will be working with the field to move those dollars out so that they can be invested in services as well. There is a lot happening within state government and within our department specifically, and you should be able to see on the screen now some resources that you can check in order to make sure that you're staying abreast of what's happening. I would encourage you to join our listserv. You can do that under the on our website on the publications area down in the lower right hand corner. Sign up for our e-news updates if you haven't already, and you can watch as we roll out these initiatives in the coming weeks and months. In general, though, there is a lot going on, and we're really excited about it. We see this as an opportunity to move forward in on quite a number of initiatives. And I encourage you to stay connected with us, and we'll look forward to a lot of progress. Thank you.